January 20th, and it's a beautiful day in southeast Kansas, right, Sammy?
Sure.
Absolutely is. Hey, we've got some birthdays today. We've got, like we talked about, we've got another staff member birthday. It's Shane. Shane GALBRAITH, happy birthday to you. And then we've got Macey Allison, Dennis Blazic, Valarie Keely, happy birthday, Valarie. Justin Knaup, Marie Satzler, Bonnie Stutesman. Bonnie's on the school board over at Carl Junction with me. I give her a hard time every chance I get because it's fun. Connie Wary, happy birthday, Connie. And Helen Wuertele, happy birthday to you. Then, real quick, some Facebook friends' birthdays. Eric Beebe, he's the husband of the Getsy rep over in the Joplin area. I've known her since she was a little kid, so happy birthday to Eric. And Richard Crow, you know who Richard Crow is? Mm-mm. Richard Crow is sang lead with the Missourians when I went through the first time back in the early 90s.
Right on.
So it was Bobby Durham, Richard Crow, Gerald Burnside, and myself singing like in the 91, 92 era. Well, it doesn't seem that long ago, but it's been almost 20 years. So happy birthday to you, Richard. Let's see, we already mentioned Shane and Valarie. So happy birthday to Valarie Keely and Shane GALBRAITH again. So we'll have more tomorrow. Go back to the vlog. Question of the day is, what are some signs of oral cancer? There's early signs. There's sometimes a redness, unexplained kind of a rash-looking type of thing, unevenness. The tissue inside your mouth all tends to be pretty pink and shiny and and very flat, no raised parts to it for the most part. If you start seeing something red, is an early sign. If you see something that's ulcerated and white, that's not a good sign unless we all have aphthous ulcers and cold sores and fever blisters and all the different names we have for things, and those come and they go, and that's virus, and that's nothing that's dangerous. But if you have an ulceration in your mouth that sticks around for a while, it's something you probably ought to check out. Bumps, lumps, anything like that that's unexplained, unexpected, and doesn't go away is not good. Something that's a white, that doesn't tend to rub off, a white streak, something like that. But if you're you also are looking to have had some type of history of things that help cause oral cancer, and that's chewing tobacco. Chewing tobacco will cause, when we see chewing tobacco on patients that we kind of get a little concerned about, is it's almost like it's hills and valleys, kind of a rough type of a look to it, and that's not good. And we point it out to any patient that's chewing. Of course, pipe and cigar smoke's much more of a throat, lip, tongue, mouth type of cancer. So if you have some of those histories, alcoholism is some to an extent. I mean, you're not just going to all of a sudden have oral cancer, but it's something to watch and let your dentist check things out for you. There's some techniques that can be used to help find it. Let's see. We cover oral cancer pretty good. I can't speak. Oral cancer, and it's not good. That's no, you don't want to have that. That's very disfiguring and very lethal. Link of the day. Sam found some babies talking. She just thought, at least they're not falling down and busting their head or something, right? None of that?
No.
Okay. So, if you'd like to follow our link, we just try to have fun stuff from time to time. If you get a chance, take a look at my blog, fatguyrunningsblog.com. It's just me writing some stuff, and I'll probably write something tonight. I haven't written for about a week, so it's about time to put some things in, doing some stuff that I just talk about what I think and try not to offend too many people. So try to keep it light. But yeah, I'd say what I think. So, alrighty. Oh, look at that. 5 minutes have gone by so quickly, haven't they, Sam?
Yes.
You ready for me to get out of here?
Sure.
Okay. Hey, all those have a happy birthday today, and we'll see you tomorrow.